Hello everyone, my name is Lolantine, and I'm going to be going over the urban legend about Benadryl and if it can cure venomous snake bites. The four types of venom that are most well known are hemotoxins, neurotoxins, cytotoxins, and mitotoxins. So, a hemotoxic venom affects the blood and cardiovascular system. A neurotoxic venom affects the nervous system. A cytotoxic venom can cause tissue damage at the bite site, and a mitotoxic venom, which is primarily in sea snakes, can cause severe paralysis. So the hemotoxin affects blood clotting and makes it hard or impossible for the body to do. It causes organ degeneration, internal bleeding, and intense tissue damage. As you can see by this person's foot, it has blackened and the skin has died. A neurotoxin can kill a person in 30 minutes if the dosage is high enough within the bite. It is considered to be the deadliest venom because people who have been bit might not know they have been, because the puncture mark can be small and have very little pain. The black mamba is one of the most well-known snakes that has a primarily neurotoxic venom, and it's considered to be Africa's most venomous snake and has a 100% fatality rate if not treated. And the last one I'm going to be talking about is the cytotoxin, which causes severe pain and destroys tissue at a molecular level. And one thing it can be called is cell death, which is irreversible. As you can see in this person's hand, it has blackened and died. Overall, the venom in a snake can come in many different configurations, and it can have properties from a cytotoxin, neurotoxin, and hemotoxin all within the same venom from the snake. So the type of antivenom you're being administered plays a major role in surviving the snake bite. So let's talk about Benadryl. Benadryl is used to help with allergies, allergic reactions, and is a type of drug known as an antihistamine. And as the name suggests, it blocks the histamines that your body releases during an allergic reaction, and it is not effective when treating a snake bite. Venom can cause pain, swelling, redness, nausea, vomiting, low blood pressure, swelling of throat, bleeding, and tissue death. This shows how Benadryl is not an effective or useful treatment for any of these symptoms. When administered to the hospital or ER, you may be administered Benadryl before the antivenom. But this is because of the rare case where you would have an allergic reaction to the antivenom and not because of the venom itself. The Benadryl only helps with an allergic reaction. Antivenom is the only cure for when you're bit by a venomous snake. According to the World Health Organization's, antivenoms remain the only specific treatment that can potentially prevent or reverse most of the effects of snakebite envenoming when administered early in an adequate therapeutic dose. Therefore, Benadryl is not effective or useful in any way when treating a snakebite. Getting to the hospital and receiving the proper antivenom is the only cure for venomous snake bites. Thank you for listening, and here is my works cited.